In this video we will talk about salivary gland stone, salivary glands, swollen salivary glands and blocked salivary gland home remedy. Don't forget to like, share and subscribe to our YouTube channel to be notified when we upload new videos daily. Salivary gland stone are small stones that form in the glands in the mouth. Salivary gland stone can block the flow of saliva and cause pain or discomfort. The medical term for salivary gland stone is sialoliths. When they block the salivary glands, this is known as sialolithiasis. Salivary glands are rarely a cause for concern, and people can often get rid of them at home. However, some salivary gland stone may require treatment from a doctor. What are salivary gland stone? Salivary duct stones are masses of crystallized minerals that form in the tubes that saliva passes through after it's made in your salivary glands. Blocked salivary gland known as sialolithiasis. The blocked salivary gland stone is often referred to as salivary duct calculus and mainly occurs in middle-aged adults. It's the most common cause of blockage in the salivary glands. The salivary glands in the mouth produce a liquid called saliva. Saliva protects the teeth, helps with chewing and swallowing food, and initiates the process of digestion. The mouth contains hundreds of minor, or small, salivary glands. There are also 3 pairs of major, or large, salivary glands. These large salivary gland stone are 1. Parotid glands, which sit below the ears on the inside of the cheeks. 2. Submandibular glands at the bottom of the mouth near the jawline. 3. Sublingual glands, which are underneath the tongue. Salivary stones are small deposits of calcium and other minerals. They can form in the ducts or stones of any type of salivary gland. Larger stones can block the flow of saliva and cause the glands to swell. According to research from 2012, more than 80% of salivary stones form in the submandibular gland, while 6 to 15% occur in the parotid gland, and 2% are in the sublingual and minor salivary glands. What are the symptoms of salivary gland stone? The main symptom of salivary gland stones is pain in your face, mouth, or neck that becomes worse just before or during meals. This is because your salivary glands produce saliva to facilitate eating. When saliva cannot flow through a gland, it backs up in the gland, causing swelling and pain. Salivary stones do not usually cause symptoms when they are forming, and they can sometimes disappear on their own. The stones can vary in size, but they are usually hard and white. Larger stones can block the flow of saliva in the gland. Blocked salivary gland can cause saliva to build up behind the stone, which can lead to pain and swelling. Symptoms of blocked salivary glands are 1. Pain or swelling below the jaw or ears. 2. Pain that increases when eating. 3. A sore or painful lump under the tongue. 4. Salivary stones can sometimes also lead to infection in or around the affected gland. 5. Fever. 6. Formation of pus around the stone. Causes of salivary gland stones. Certain substances in your saliva, such as calcium phosphate and calcium carbonate, can crystallize. Salivary gland stone can range in size from a few millimeters to more than 2 centimeters. When these stones block your salivary ducts, saliva builds up in the glands, which gives you swollen salivary glands. The reason why the salivary gland stone form in the first place isn't known. Risk factors of having salivary gland stone and swollen salivary glands. 1. Taking medications, such as blood pressure drugs and antihistamines, which reduce the amount of saliva produced by your glands. 2. Being dehydrated, as this makes your saliva more concentrated. 3. Not eating enough food, which causes a decrease in saliva production. Doctors do not fully understand what causes salivary stones. However, certain factors can increase a person's risk of getting swollen salivary glands. These risk factors include: 1. Having gout or Sjogren's syndrome. 2. Having kidney problems. 3. Not drinking enough water. 4. Powered by Rubicon Project. 5. Advancing age. 6. Having radiation therapy on the head or neck. 7. Mouth injuries. 8. Taking medications that affect saliva production, such as anticholinergics. Blocked salivary gland home remedy. Salivary stones are rarely serious, and a person can often treat them at home. Home remedies for getting rid of salivary gland stone are: 1. Sucking on citrus fruits or hard candies. 2. Sucking on a wedge of lemon or orange increases the flow of saliva, which can help dislodge the stone. 3. Sucking on sugar-free gum or hard, sour candies, such as lemon drops. 4. Drinking plenty of fluids. Regular fluid intake helps keep the mouth hydrated and can increase saliva flow. 5. Gentle massage. Gently massaging the affected area may relieve pain and encourage the stone to pass through the salivary gland. Medications. 1. Drugs, such as ibuprofen and acetaminophen, can help relieve pain and swollen salivary glands. 2. Sucking on ice cubes. 3. Sucking of cold substances, such as an ice cube or ice pop, may also help reduce pain and swelling resulting from salivary stones. Salivary gland stone treatment. 1. For dry mouth, good dental hygiene and sometimes drugs. 2. For salivary gland stone, pain relievers, fluids, physical measures, or sometimes salivary gland stones removal is required. 3. For infection, antibiotics and physical measures. 4. For swollen salivary glands, various treatments, possibly including surgery. Home remedy for dry mouth, people are: 1. Brush and floss regularly. 2. Use fluoride rinses. 3. Avoid drugs that decrease saliva production. 4. Sip fluids throughout the day. 5. Visit their dentist for examination and cleaning every 3 to 4 months. 6. Chew sugarless gum or suck on xylitol lozenges frequently. Some dentists have people wear plastic tooth covers filled with fluoride gel at night to prevent tooth decay due to dry mouth. Drugs that increase saliva production, such as cevimeline or pilocarpine, help relieve symptoms. Such drugs may not help when the gland have been damaged by radiation. For salivary gland stones, people can take pain relievers, analgesics, drink extra fluids, massage the glands, apply warm compresses, and trigger saliva flow with lemon juice or wedges, sour candy, or a combination. If the stone does not pass on its own, a dentist can sometimes push the stone out by pressing on both sides of the duct. If that fails, a fine wire-like instrument can be used to pull out the stone. As a last resort, the stone can be removed surgically or through an endoscope. For salivary gland infection, doctors give antibiotics and have people massage the glands and apply warm compresses. A salivary abscess needs to be cut open and drained. Staying hydrated, triggering saliva with lemon juice and hard candies, and having good oral hygiene are also important. Swollen salivary glands treatment varies with the cause. A mucocele that does not disappear on its own can be removed surgically if it becomes bothersome. Similarly, both non-cancerous and cancerous salivary gland tumors can usually be removed surgically. When to see a doctor? Salivary stones can sometimes cause infections or abscesses, so people who are unable to remove the stones by themselves should see a doctor. If the doctor is unable to remove the stones, they may refer the person to the hospital. Anyone who has signs of salivary gland infection or abscess should see a doctor immediately. A doctor can usually treat salivary gland infection with antibiotics. Warning: none of the information on our videos is a substitute for a diagnosis and treatment by your health professional.